Hi, everyone, and welcome. I know some people are still joining, but just to get things started, I am Jeremy. I'm a representative of EHN Canada. If you are new to EHN Canada, we are a nationwide network of treatment centers for addiction, trauma, and mental health. We have facilities located in British Columbia, Alberta, Ontario, Quebec, and Nova Scotia. We offer high-quality inpatient, outpatient, and online treatment programs. For more information, please check out our website at www.ehnccanada.com. Just in terms of housekeeping, everyone is on mute and cameras are off for today's webinar, but please feel free to use the Q&A box located at the bottom of your screen to submit any questions for our speaker today. We will try to get to as many questions as we can at the end of today's session. And if you are wanting to turn off the chat preview box, please click the up arrow located at the bottom right of your chat box and uncheck the chat preview option. And please remember that this is a professional and inclusive space, and any offensive commentary will not be accepted nor tolerated. Today's webinar is being recorded, and we will be sending out a follow-up email sometime mid to late next week with a copy of today's recording, the slides being presented, and any additional resources that we mentioned throughout this presentation. We will also be sending a copy of your CEU certificate with that email. Again, that email will be sometime mid to late next week. We appreciate your patience. I am located in Toronto. Toronto is located on the traditional territory of several nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. It is covered by Treaty 13 with the Mississauga of the Credit. Annie is located in Pass Creek, British Columbia. She is located on the unceded homeland of the Sinixt Nation, the Kitunaha, and the Sayux people. If you're new to this work and want to find out whose land you are on or grew up on, please check out www.native-land.ca for more information. Many more of you may be physically present elsewhere, and I encourage you to share whose land you're on if applicable. And now to get to today's session, the intro to trauma and the NeuroAffective Relational Model, also known as NARM. And we have Anni Muhlegg, and Annie has been passionately engaged in the field of mental health and addiction for over 20 years in both the public and private sectors. Annie joined EHN Canada in 2019, first supporting the aftercare services prior to joining the intensive outpatient programs full-time. Annie grounds her practices in a psychodynamic, transpersonal, and whole person approach to wellness. Her approach to recovery is guided by a compassionate inquiry approach grounded in curiosity, resilience, and heartfulness. Annie holds a bachelor's degree in social work and a master's degree in counseling psychology. Annie is currently completing a 2-year level 2 training for psychotherapy with the NARM Institute, known as the NeuroAffective Relational Model, for healing developmental and complex trauma. And now I will pass it off to Annie to guide you through today's presentation. Thank you so much for joining today, Annie.
Thank you so much, Jeremy, for having me. And according to the chat activity, it looks like we have a lot of presence with us today. So Aichka, thank you. Merci for that, everybody. Thank you for being with us. Yeah, before we get going, I just would like to extend gratitude to you, Jeremy, to your entire team, for all the work that goes behind the scene with providing support for learning and sharing and exploring how to improve practices from the different levels of care. So I just want to say merci, thank you for that. And also thank you for the leadership team supporting this work. And a little bit of a disclaimer before we dive in is I love this approach. I feel personally connected to it, professionally connected to it. But in my work with EHN, it's not an approach that we're yet including in our work, at least formally. And so my hope for today is more from a complementary model approach in how I'll be sharing this fascinating, I think it's a fascinating and complex and very dynamic model. Before we dive in though, I'd like to just take a few moments to just allow myself to land. I'm still kind of landing into the space. And so I'd like to invite each of you, if you'd like to join me in 2-3 minutes of what I call arriving exercise, an arriving exercise. Some people call this mindfulness. Most days I feel my mind is full enough, so I like to simply take the pressure off and call this tuning in or arriving exercise. It's optional, and so feel free to adjust this exercise to best fit where you're at in this moment, in your own location. And I'll guide us through it, and it'll be about 2-3 minutes. Again, it's optional. You can adjust it. Eyes can be open or closed. And the practice is very NARM aligned. It's very embodied, inviting us to first connect with our own internal experience. Simply perhaps noticing what it's like to transition from whatever we were engaged with today prior to this moment. There's no place to get to. There's nothing to get rid of. The practice is simply an invitation to notice internally our orientation into this platform here together. And before we open up the space to learning and sharing, I'm inviting us to feel into our own personal internal experience. Perhaps noticing any cognitive activity or thoughts with our creative, bright minds. And the invitation is to notice without necessarily attaching to any thoughts. Just noticing perhaps cognitively what's happening in our own internal experience. Noticing what's happening physically, if that's accessible to us, each in our own way. And linking that also to noticing what's happening emotionally and our related senses in this here and now moment. Feeling into our spaces, perhaps looking at textures, shapes, colors, and linking the sounds in each of our respective spaces in addition to my voice. What are perhaps the other sounds that you're connected to in this moment? Sights, sounds, smells, and our own capacity to connect to our internal experience and just really allow ourselves to land each in our own way as fully as possible in this moment. I'll be quiet here for about 10 seconds, just inviting us to lean into a little bit of silence and space. Great. Thank you so much for joining me in this optional practice today as we arrive from what looks like different time zones and locations and life experiences. So thank you so much for being here with us. So let's dive in. This model is something I'm really deeply passionate about, but a little bit of a disclaimer. I'm using it discerningly. I'm practicing the NARM protocol and scales and approach discerningly in our treatment program with Outpatient Services. And so it's from that complementary lens that I'll be sharing that today. So a little bit of what to expect in our time together today. My hope is to be presenting for give or take between 45 and 50 minutes or thereabouts. And then we'll open up the space for a transition into a little bit of reflective questions. Whoops, there we go. And then we'll have Q&A as Jeremy mentioned earlier. I'll first introduce what's NARM from a broad perspective, and then I'll link it to some of its understanding of how it frames human adaptation to change and difficulty and different levels of traumas, specifically with relationship to attachment relationships in developmental years. And I'll speak briefly about the 4 pillars in the treatment protocol, and something that NARM highlights as the disidentification process. And I'll speak about that in a little bit here. I'll shed some light on what that means from a NARM perspective. And then we'll end our time together with some optional reflective exercise in connection to some of the teachings, at least from a NARM perspective, on the therapeutic dynamic of transference, countertransference, and what NARM calls transference strain. So without further ado, let's dive in. So big picture in terms of NARM was developed quite a few years ago through the work of Aline Lapierre and Dr. Lawrence Heller, who partnered up more than 20 years ago and developed this approach of linking body-centered psychotherapy as well as cognitive approach to psychotherapy. Because they were finding that often there was some needs in terms of being able to merge different approaches and modalities, specifically in a safe way, meeting people's needs where they're at. And the institute, the NARM Learning Institute, was developed more recently, and it's a very large international community of practice, of support, of learning, and it's fascinating. There's different levels of training, and there's an introduction training, there's a level 2, there's a master's training, and then there's a postmaster's training. And I'm kind of mid-range in my learning with NARM, and I think I'll be learning my whole life in this model. It's quite fascinating and it's deeply humbling. The model is based in an attachment-based model. So there's some theory around Maller's work or Bowlby's work. It's very relational, and it's very interested in looking how human beings develop emotionally in attachment relationships, and how these attachment-based relationships from prenatal through all our developing years, how that really deeply impacts how human beings adapt to stress, especially emotional triggers, and to life, to change, through this wild gig called life that we're all in. And so it's deeply interested in looking at issues connected or meaning making, personal meaning making that all people have a capacity to do in terms of their identity and how they make sense of their experience emotionally, physiologically, behaviorally, and particularly within interpersonal relationships. The model is very relational, and it sounds kind of fluid and very broad, but there's a very clear and structured protocol that guides the practice, the NARM-specific practice. So it's kind of this beautiful mix. I think it's beautiful. I'm a little biased, of course, of attachment theory, psychodynamic, humanistic, feminist, cultural humility, compassionate inquiry. So I'm kind of throwing lots of jargon out there, but feel free to ask questions later, or put it in the chat if you feel to bookmark anything that stands out for you. If any of that needs clarification later, I'll be happy to clarify. So NARM in a nutshell looks at our capacity as human beings to be able to integrate our different aspects of how we make sense of our experience from what I like to call the 3 brains. The cognitive brain, a little bit kind of borrowing some of Dan Siegel's work of interpersonal neurobiology, of our capacity for higher thinking, our right prefrontal cortex activation, connected to our capacity for empathy and compassion, and holding space for ourselves in a good way in others. So the higher thinking brain, capacity for higher thinking, solution finding, and this activity in our traditional, at least Western traditional models of care is very active, it's very cognitive. And NARM also really emphasizes the importance of linking our high capacity for thinking and solution finding and structuralizing, to also dropping into our felt sense and what NARM calls heartfulness. And so it's a very heart coherence based as well. Some of you might be familiar with some of the teachings and research that came out of the Heart Math Institute, for example. So it's very congruent and aligned with that. And finally, also the third brain, the gut brain, our capacity to feel into our intuition and know what we need from that more integrative place of all of our intelligent and complex systems as human beings. So the model, if I were to really summarize it, it's extremely capacity-based, and it's interested in exploring with whoever we're sitting, including ourselves, what's the connection with our sense of agency. Because often when we struggle in life, or when we've had developmental trauma or some level of trauma in our human experience, we've had to adapt. And so NARM is really curious about how human beings adapt. And in the therapeutic context, often people come to the therapy arena with symptoms and conditions and diagnoses sometimes, and really a wish. Often I've heard this countless times, by clients stating that they really want to get rid of the pain, or they want to get rid of the symptoms, be it anxiety or depression or some of the adaptive patterns behaviorally around connected to addiction, for example. So NARM is extremely fascinated by what's underneath these symptoms, and emphasizes the importance of being able to understand and explore what drives these symptoms, because we look at relapse rates. Whoops, a little too quickly. We look at relapse rates, and often people do relapse to old behavior that have been adaptive in some way for many years for some of us human beings. And so I really love this compassionate and curious approach. It's very curious, it's very depth oriented, and it's really aligned with asking really important questions around what the symptoms have served. So a little bit here at a glance of what NARM is and what NARM is not. So it's primarily present focused, what's happening in the here and now in our experience with ourselves and whoever we're sitting with. It's very interested in looking at how people have adapted to different situations, specifically in this context, trauma, different levels of trauma, specifically complex trauma in developmental years. It's containment oriented. It doesn't look for cathartic. It's not trying to make any cathartic situations happening, although sometimes that does happen in therapeutic context. Similar to somatic experiencing and other models, it's very resource oriented, inquiry driven from that, what I named earlier, that compassionate inquiry. Some of you that are familiar with Gabor Mate's work, it's very aligned with that. And it's really curious about what's happening internally, both to our own experience as care providers, to whatever capacity, as well as noticing what's happening in someone else's experience without necessarily interpreting for them what's happening. So NARM tries to stay away from any interpretation. It stays in a place of curiosity. And finally, it's also really interested in looking at any shifts that happen within the therapeutic exploratory context, linked to what are some of the underlying patterns that are driving some of the symptoms, as mentioned earlier. It's client-driven, with the practitioner more as a guide to help create that structure and to invite whoever we're sitting with towards their own capacity for exploration, maybe reclaiming some of the parts of themselves that they had to disown in order to survive. So this is true specifically for people that have had significant developmental trauma. I mean, it's all significant. It depends on how someone experiences their own experience, but there's different levels in terms of personality styles and how human beings learn to adapt accordingly to our life experiences specifically to attachment figures. A little bit here, following the thread of the compare and contrast, NARM is deeply trauma informed. It's very much interested in asking adaptive questions around, or questions around how people have adapted. It doesn't tend to focus on pathology or problems, in contrast to the disease model or more traditional medicalized models. It's not that it's not interested in symptoms and noticing those, but it's really deeply curious, as mentioned, as what's driving those symptoms. Some of the more common or traditional views often use labels to describe pathology, whereas trauma-informed, and specifically NARM, looks at how clients have had to adapt. And so it's more of a humanistic lens. Finally, compared to more traditional views, a NARM model or NARM-oriented therapist will really, and there's many models that do that, MI, for example, and other models, and everyone has their own expertise in terms of how they like to create that therapeutic alliance with clients. NARM is really specific in being more a guide, in a fellow walker, kind of walking alongside experience, in making space for that reclaiming or that connection to some of the parts of people disconnect or disown from themselves because perhaps it wasn't safe for them to connect to those parts of themselves. And I'll speak a little bit more to that in a minute. So the helping professional is more of a collaborator. And finally, compared to some of the more traditional models, the goals can be really highly defined or heavily defined by the professional, focusing on symptom reduction and behavior change. And NARM posits that it's not that that's not important. Of course, we're hoping for improvement, and it's amazing when there's a shift, and truly when symptoms are reduced or big transformations across the spectrum happen. But the focus with NARM is to really be curious about what the clients really want for themselves. And so it's based in self-efficacy and a sense of agency, and for them to be able to lead their own healing process. So we're almost done with kind of this broad explanation of what NARM is. And then we'll go into a little bit more of the core in terms of the protocol and some of the therapeutic steps that NARM highlights as really key. So bottom up and top down. NARM is really big in highlighting how that's really, really key to be able to, in the therapeutic context, adapt and adjust our approaches and our interventions to include both the body when it's appropriate and the client is able to connect in a way that's agency oriented and capacity based without feeling too overwhelmed. So if clients come to us highly dysregulated from a NARM perspective, and other models such as SE, somatic experiencing, and other body-centered therapies, there's different approaches on the timing, on how to bring curiosity to connect to those parts of our experience. The caveat here, the difference with NARM, is that it really does not push for contact with emotions or the body, especially when the person is not ready, because those parts of connection with our bodies and emotions, for folks that have had developmental trauma, and I can relate to this, there's been adaptive strategies that actually lead for folks to really disconnect from their felt sense, emotions, and or within the body. So that's why NARM emphasizes the importance of both bi-directional loops of information and how integration can happen in that fluid process. So it's both top-down, body-centered to cognitive, and cognitive to body. And so there's kind of this natural mediation system that happens. And NARM, along with similar theories such as the polyvagal theory, highlights that this is always happening on some level. Neuroception, interoception, for those of you who are familiar with Porges's work, NARM is very aligned with the polyvagal theory. It really emphasized the need for fluidity and not rushing the process in terms of integration or trauma resolution. So I hope that made sense. Again, feel free to chat in some of your questions and bookmark some of those later. I hope we will have time to cover them later. NeuroAffective Relational Model. There's a big phrase. I think I've spoken to that already, looking at the science of neurobiology and how that impacts our ability to connect with ourselves and others. Affective, because it's deeply connected to attachment theory and how the impact, at least the impact of early life relationships, have had in our developmental years. And relational, specifically in the therapeutic process, because that can be really triggering and really vulnerable for many people. And I can understand that, that vulnerable place of inviting ourselves to connect on a level that's more authentic can feel deeply threatening for some people that have had to disconnect from their sense of self or their authenticity, perhaps because it wasn't validated or acknowledged or understood in developmental years. So again, symptoms here from NARM perspective are really seen as survival strategies. So it's very resilience-based, post-traumatic growth-based. NARM is one of the aim goals as well, is to be able to explore with the client and ourselves, for some of us that are doing the NARM recovery work with ourselves, and it's been a game changer in my own life, is to be able to resolve these patterns of disconnection and related symptoms through inviting our sense of curiosity. It might not always feel compassionate, but there's a sense of curiosity. Because often a lot of our adaptations have been, for many people, have been shame-based or pride-based, feeling like it has to be this way, or feeling not undeserving in certain situations. So there's this kind of, from an NARM perspective, there's this core dilemma sometimes around really wanting something, but really being deeply afraid of it, especially in relationship and connection. So the overall aim, when there's successful and embodied and connected moments in session, there's some level of disidentification and resolving on some level some of these old identification processes around disconnection. And I'll speak to that in a few moments here as well, a little bit more. So moving beyond symptoms, exploring. NARM posits that before we can actually move beyond any symptoms, before we can actually move beyond any patterns, NARM posits that it's really important to actually be exploring what drives those underlying patterns. And when there's a successful process with NARM, when there's integration and the person is starting to connect with our sense of agency and capacity, and for insight and understanding how, for example, some of the old adaptive strategies that are still with them may not serve them anymore. So NARM calls that moving from child consciousness and adult consciousness. It's a really broad teaching. I don't have time to share in this context, but it's some of the language that NARM uses. So you can notice it's fairly psychodynamic. And there's no judgment, though. I do want to highlight that. Child consciousness is simply the parts of ourselves that have had to adapt in a certain way, and some of the secondary emotions that are linked to that. When it hasn't felt safe, for example, to connect to some of the original heartbreaks or unmet needs. So when we start moving into adult consciousness is when we're actually able to start disidentifying from some of the old patterns that perhaps no longer serve us. I'll speak to that a little bit more in a moment. So we're moving forward. The 4 primary organizing principles for NARM: supporting connection and organization, internal organization. And the key piece here is that we're not pushing for it. A NARM-oriented therapist does not want to push for that, although it's really lovely when it happens. It aims also to explore identity. Often people will come to the therapy context with, as I've mentioned earlier, wanting to get rid of symptoms, wanting to be well, and yet really bypassing the exploration around how they've learned to adapt. And so from a NARM-oriented model, it invites a stance of more compassionate inquiry around, my goodness, those adaptive patterns actually were needed. And now they get in the way of often of what people want for their life. Again, working in present time, we're not really looking at, the NARM-oriented therapist not really looking at the details and the narrative that the trauma or the past, although people will talk about that sometimes. So it always gives important information in terms of how someone orients to their experience. And an NARM-oriented therapist really wants to kind of bring it back to the moment of what's happening in the here and now, and how someone relates to their life experience and what has happened. And fourth point here, it's not less important, it's just as important of all of what I've mentioned, and it's actually really core, central to NARM, is this concept of co-regulation, which I'm sure a lot of you are familiar with in your own practices and work. And in NARM, it's called 50-50. And perhaps I can invite us here for an optional brief experience of what I mean by this. So the 50-50 is our capacity to be connected to our own experience from an internal process, as well as aware and connected to whoever we're with. In this context, for me, it's kind of like I'm trying to feel into the presence. You know, I have some colleagues I'm hoping that are here. So hi, and Jeremy and some beloved friends. And so I'm feeling my connection to them, but it's limited because I don't have the narrow, biofeedback process of being able to see your faces and connect that way. So in a NARM-oriented model, at least in the therapeutic context, there's always feedback happening. And as we know, communication happens mostly non-verbally. And so this aspect of co-regulation is really, really key in NARM, in being able to at least come back, because we can't statically stay in 50-50. That would be a lot of pressure. But to be really noticing, am I leaning in? Am I losing connection with me because I'm so passionate to share this process with you all? Or am I getting really anxious and I go into my head and I lose the connection? So those are examples. So our capacity to regulate, co-regulate. The 5 organizing developmental themes. Finally, we get to the core of a little bit of what I mentioned earlier. So from a NARM perspective, human beings, just checking on the time here, we're good. Human beings develop our capacities for connection, attunement, trust, autonomy, and love, and healthy expression of sexuality through our developmental years, from prenatal through toddler, childhood, youth, and early adulthood. And they're not separate, they all kind of flow into one another. And from a NARM perspective, those capacities are so deeply connected to our primary needs, especially in our developmental years. Needs of connection, needs of attunement, trust, autonomy, and love. And so to the degree that these needs are met especially in our developmental years growing up as human beings, to the degree that these needs are met, then from this model, then we have a capacity for regulation. There's a capacity for sense of connection with ourselves and others, where we can feel safe in our environment, unless there's something unsafe happening. There's a sense of flexibility. There's a sense of being able to be a little bit more fluid and spontaneous, and kind of this overall sense of aliveness and capacity to feel kind of expansive. And to the degree that these needs are not met in our developmental years, then from this NARM model, it posits that human beings develop these adaptive strategies, as I've mentioned earlier, in order to manage, in order to cope. And in some situations, it's actually at that instinctive survival level in order to be able to cope with the earlier life experiences especially when we're so dependent and vulnerable. So a little bit more on that, the 5 organizing developmental themes linked to attuned environments, capacities for connection, leading to secure attachment. I'm sure a lot of you are familiar with the attachment theory and Maller's work and Bowlby's work. And to the degree that the needs are not met, as I've mentioned before, leading to disconnection. And we're not blaming parents here from a NARM perspective. It's not the parents, that's never helpful, but the way that it's framed, it's seen more as an attachment failure or an environmental failure, leading to disconnection and those compromised core capacities. And again, from a resilience perspective, adaptive coping strategies. A little bit more on those core needs and core capacities. So feel free to have a scan through here. For example, our capacity to be connected with ourselves, our bodies, our sense of being able to be in relationship with others in a way that's connected. That's goes way back from this theoretic model of NARM and practice, connected to our core primary need and the primary emotions that were expressed and were supported and attuned with. So capacity to be in touch and have a safe experience of expressing that and connecting to that. And key to this is, some of you might be familiar with the separation, individuation, developmental years. I think that's Maller's work in part. And so in line and congruent to that, our capacity to be in connection and develop through these different core needs and these capacities through our developmental years to be able to grow a sense of healthy connection with ourselves and others. And so separation, individuation, connection, and capacity for healthy interdependence. These slides will be available to everybody. I hope, Jeremy, maybe you can clarify that. And so you'll have access to the content.
They absolutely will be shared.
Great, cool, thank you. So I want to move on because I think you get the picture. I do want to move on for here to emphasize specifically from a NARM-oriented model, because we're talking about working with complex trauma. So back to this theme of when these core needs and capacities, or let me slow down here. When those core needs, I lost my 50-50, so I'm gonna come back. When these core needs are not met, then NARM posits that it leads to these survival adaptive styles. So these are examples, broadly speaking, of when the core needs connected to attunement and connection, and having our needs met and feeling safe to ask for what we needed, being able to set healthy boundaries, etc. So to the degree that these needs were not met, and there was a original, what NARM calls this original heartbreak back in those developmental years, children didn't have, as children, we don't have the prefrontal cortex development to actually understand what's happening and think, oh yeah, I'm resilient, I'm gonna make it through this, I'm gonna eventually, experience post-traumatic growth, and I'll be able to be more connected to myself because I'm resilient. It's too threatening, and we don't have that capacity at that time when we're that young, and so we disconnect. It's too threatening. And depending on the original heartbreak, what NARM calls the original heartbreak, or the unmet needs, at times chronic neglect or unmet needs. Some of you are very familiar with the ACE studies, for example. So NARM also in the training really emphasizes the impact of early adverse childhood events. And so those core difficulties, it doesn't mean that we don't have the capacity. Inherently, NARMs highlights how human beings have those capacities, but those adaptive strategies have gotten in the way because they were needed when those primary emotions and core needs were not met. So for example, a lot of folks that I've been working with often feel like they're a burden, or they feel overwhelmed and burdened. So there's this kind of difficulty setting boundaries. From a NARM perspective, that's understood as the autonomy survival style. Feeling like, oh, I got to do it all by myself. I can't trust others. So there's other examples I'm sure we can think of. Perhaps another one here is someone that develops later in maybe teen years, where their sense of love and healthy kind of pre-tween years development of sexuality, if there was some shaming around that, or whatever happened in their developmental time and during that time where there was trauma, from a NARM perspective, the core difficulty here is understood as really having difficulty connecting with our own heartfulness and being able to feel connected with others from that intimate, vulnerable place. And so often people that really identify for their sense of self-esteem, identity, by actually always having to do more, or always having to have a high level of performance. So there's many examples. Unfortunately, we don't have time to go more into the crux of this, but it's a super rich context. So ready to move on. In terms of therapeutic scale and the treatment protocol, really key here with NARM in attune to respecting where someone is at in their process is these 4 pillars. Pillar 1, clarifying the intention of why someone's coming to therapy. And as simple as that sounds, that can be really difficult for some people because they often come to therapy because they want to get rid of something, understandably, because it creates a lot of pain, suffering, distress, symptoms of overwhelming anxiety and depression to whatever degree on that spectrum and continuum of mental health. Can be really difficult. Those are difficult experiences. But from a NARM perspective, being curious around exploring what's driving those symptoms. And so pillar 1, setting the intention. So if someone doesn't really know, the NARM-oriented therapist will really take their time in exploring. So if you knew, what would that look like? For example, if someone comes to the session and say, I don't know, I just feel off today. And so from this perspective, NARM emphasizes how the person's there. So there's part of them that actually believes in some change. So in this way, it's aligned with motivational interviewing. And so going slow, clarifying the therapeutic contract. Someone, for example, might want to have a clearer sense of their capacity to emotionally regulate because they want relationships, but they're coming to therapy because there's a lot of challenges and conflict and it's just too overwhelming. So there's that core dilemma, intimacy, not feeling safe, but also wanting that. So there's an example. Pillar 2, when this is clear, and this is fluid, it's kind of like an informed consent process where the contract, and we don't use that language with clients, but it's just for the clinical protocol for therapists to kind of guide their work. That's fluid. And so if someone through their work and their therapeutic connection with a therapist, and if it's aligned and if they're attuned, there's possibility to grow that the intentions, what we often call goals. But again, it's not so linked directly to behaviors, because NARM posits that if we make space for looking at what's underneath the symptoms and behaviors, that will eventually invite changed patterns behaviorally. But NARM really emphasizes how it's really important not to rush that. Pillar 2, asking exploratory questions, really being curious about what's that like to name that someone wants something really important for themselves, but at the same time, it might be also terrifying to them. And so when the client has capacity to start recognizing their strategies of adaptations and also recognizing that that's what they had to do, and there's a sense now that maybe some of that gets in their way, from an NARM perspective, it's called the starting to be connected to a personal agency. So knowing when some of our own patterns get in the way of what we want. And initially, when that starts to happen in the therapeutic process, that can actually be very disorienting with somebody, because that's kind of internal shifts, psychobiological shifts that's happening, which is number 4. So when agency is online, when the person is not defaulting more habitually to their primary emotions or the defenses of avoidance or disconnection, although that happens sometimes, but when agency is actually online, then the pillar 4 is invited in the therapeutic process from the therapist, inviting, guiding, connecting, or being curious around those moments of connection. So tracking it, connection, disconnection. And the tracking of connection and disconnection to support from that structuralization, what that NARM calls that structuralization of psychobiological capacity. So a little bit more on the protocol here, and I'm aware of the time. I'm not going to read all of this. It's a lot of info. So maybe I'll share pillar 1. Back to asking exploratory question about what someone really wants for themselves. Why are they there? Why are they showing up for therapy? The intention from the therapist is to guide the client towards clarifying the intention, and for the therapist to get a sense of the client's experience. The intervention is to support, and the intention is to support the clients clarify what their intention is. And from a NARM perspective, that's actually an intervention. There's nothing passive about that. It's active in that intersubjective process. And the self-inquiry invitation for therapists here is to notice how it lands for clients. And if it doesn't land, some of the invitation for clarifying the intention, then from an NARM perspective is to go slow enough to keep inquiring prior to moving into getting the consent from the client to move into exploratory questions. And so if it lands, if the client names that they'd like to be able to set clear boundaries and have a sense of feeling a little bit more confident with themselves, it's more of a state intention. And so that's fair game for NARM to move forward. And if it lands for the client, the therapist feeds it back to them by saying something like, wow, I hear you. You're really wanting a sense of more connection with yourself and have the capacity to ask for what you need and feel confident and emotionally regulate, for example. And if the client says, yeah, then we can move into pillar 2. And asking agency-based questions around, for example, can you recall a time where you're able to do that, even though it's difficult for you? So it's very strength-based in the orientation of questions. Unfortunately, we don't have time for the rest of the pillars, but we might have a sequel. Hey, Jeremy, I hope, if this is well received. But we'll move a little bit more forward here into the skills. Feel free to have a scan through. So I do want to make time here for a brief reflective exercise, which is very NARM aligned. So some of the skills in NARM, which these skills are very aligned with quite a few modalities, but specifically for NARM, it's a very open, compassionate approach, aiming to track levels of organization and disorganization without pushing necessarily for connection, just noticing. Developing positive resources where the client can have capacity to feel a little bit more of emotional charge and connection while not having to completely disconnect. So evoking positive resource and experiences through connection. Tracking, some of you I'm sure are familiar with that through your SC work. Looking at relationships to internal states. So of course, symptoms and behaviors are important, especially in our outpatient program. You know, there's a lot of focus on skills and teachings around that. And in NARM, we're also really curious around what's happening underneath some of these symptoms, what's driving those. It's very containment based, and the pacing is very important. If something's really happening there's a shift happening in the therapeutic context, it's really important to not rush to the next thing. And depending on the timing of where the session is at, if someone's feeling more connected and they're in touch with their own sense of agency, and there's a level of connection, that's a great place to end the session. I know we have a couple more slides here, so I'm going to move forth. The challenges of transference and countertransference is really, as therapists, to be able to, I'm going to move forward here, to be able to, as we all are to different capacity, to slow down enough in the therapeutic context to notice what is happening in our experience. And in NARM, there's a strong focus on how we experience that intersubjective relational experience in the therapeutic context, or in relationship to whoever we are connected with. And specifically in the therapeutic context, every intervention, there's intentionality, there's a purpose. And a strong emphasis in the training and in the model is for therapists to develop a capacity to work with dynamics of transference and countertransference, because they happen absolutely in our realm, as we know. And as obvious as it sounds, the invitation is to be able to learn how to do that effectively without having our own adaptations collide with that of the clients. And when that happens, NARM calls that the countertransference strain. So the risks of these connections, which can be really intense at times for both clients and therapists. So this moves into an invitation to continue to look at this a little bit, inviting you to think of what do you feel the difference is for you, and I'll join you in this reflective exercise. What do you feel the difference is between authentic empathy and unmanaged empathy? And how do these feel different to you? How do these feel different to all of us that are in care service role and holding space for others? How do we notice the difference on ourselves and on our clients? Perhaps some of you have done a lot of work on that already. It's a really important theme, transference and countertransference. Briefly here, NARM doesn't want to rush into emotions unless agency is online. We don't want to push for emotional feeling. So we want to support relating to our emotions and that of whoever we're sitting with. And be curious around his agency online before we go deeper into some of the emotional processing that a lot of therapists are really good at. So in conclusion, I know that was really a lot because I'm so passionate. It was actually really challenging for me to pare it down. So I hope that made sense. And before we start wrapping up, boy, that went fast, eh? I'd like to invite us here for an invitational brief question about what's our relationship to our own anger and grief when it comes up in the therapeutic context or in our own lives, and what are the strategies that we avoid or minimize sometimes to feel the intensity of the pain or whatever it is for each person in relation to anger and grief or other complex, intense emotions. And akin to that, likewise, what's our relationship to helplessness? And what are the strategies that we use when that comes up for us, especially in the therapeutic context? So when we feel pressure to try to have our clients understand that we get them, that we're there for them, you know, that from a NARM perspective, that's a red flag for counter-transference strain. Of course, we care. Of course, there's empathy. But the invitation here is to be really curious about our attachment to having a good therapeutic relationship. It's a gift when it happens, and when it's genuinely attuned. But one of the countertransference strain red flags is, for example, when we try to figure out what the client needs and try to convince them. So I wish we had more time for some of this, because that's really, to me, that's really fascinating and very important in the work that we do. So in kind of wrapping it up and inviting us here also for a little bit more of an internal experience, a little bit to how we started our time together today, inviting each one of us to think about, what does your inner quiet look like? And how do you imagine your inner quiet impact your own personal life and your professional life? Yeah. Just seeing how that lands for you guys. So we'll start segueing and pass it over back to Jeremy here. Thank you.
Perfect. Yeah, thank you so much. And to just read the quote that's being displayed right now. People have two needs, attachment and authenticity. When authenticity threatens attachment, attachment trumps authenticity.
Yeah, thanks, Jeremy. Do you feel like reading that one? I'd love to hear your voice with this one as well.
Absolutely. I'm happy to. So the spontaneous movement in all of us is toward connection and help, no matter how withdrawn and isolated we have become, or how serious the trauma we have experienced on the deepest level. Just as a plant spontaneously moves towards the sun, there is in each of us an impulse moving toward connection.
Thank you.
And thank you so much, Annie, again, for a wonderful presentation.
Yeah, you're welcome. Wish we had more time. It's such a rich, complex model. Lawrence Heller is the developer of NARM, just FYI. Yeah, I'm wondering if there's questions or comments. Jeremy, did you want to moderate?
Yeah, for sure. Again, lots of good comments, reiterating what we both were talking about, that there's definitely a need or potential for future webinars to kind of go off of this. So this was a great introduction. And again, thank you. But just to go into some questions. There is just a question, if you can further explain the 50-50 concept.
It's a great question. Thank you, whoever asked that. I appreciate it. So 50-50 is our capacity as human beings to be really more embodied with our whole being and connected. So I'll just kind of simplify it by calling it like genuine connection with our own experience, moment to moment. So it's kind of mindfulness, but it's also relational. So specifically from NARM, 50 here, 50% with my own experience, and also inviting myself to be as connected. Like right now, I can see Jeremy, that helps me in connecting to that other 50-50. So kind of like fluid. And we don't really tend to stay there. We fluctuate. Sometimes we go more internal. Sometimes we get really invested by, with our interest in others. So I hope that helps.
Yes, thank you so much. And then we have a question too. So how would you contain with someone focused on past trauma, historical events, and distrust towards support, highly sensitive and emotional?
Great question. I would really respect it, because that's an example of someone having developed we call resistance. That sounds kind of judgmental, but a protective adaptive strategy to be careful, especially with people of authority. And to be fair, the therapist can seem as like that. And so with respect, and I would just be really curious. I think I would try to stick with pillar one, asking just really intentional questions around, why are they there? And if they're, often we work with mandated clients or referred clients, and that's inherently challenging. I get that. And also, at least from a NARM specific model, and I relate to that, is there's really a strong part of me that totally believes that there's a part of that person that actually wants to be well and wants to be connected. But because of the trauma and all the patterns related to that, it's terrifying also to allow that connection. Anyhow, I hope that was helpful.
Yes, thank you so much. Looks like we have time for one more question.
Oh, yay, good.
So this person mentioned that they work with psychedelics and they can see how NARM has a good potential to work well with psychedelics in conjunction. If you could provide a little bit of commentary on that.
Yeah, I'm really appreciative of the comment. I think it's aligned. I think there's traditional plant medicine work that's kind of coming more into the forefront now as being really powerful in reaching those deeper states. A lot of risks as well. So there's a lot of ethical considerations here. There's a really cool podcast, whoever asked that question on the NARM website. I think it's a trauma podcast, and there's a resource page here as well for those of you who would like to revisit some of this, where there's actually a specific podcast on the role of plant medicines in healing. And without giving too much information, and we don't have time for that, but I've been really interested in researching that, and I've been working with traditional elders, Indigenous elders for quite some time, and I have witnessed and experienced some profound insights in connection to more traditional and earth-based modalities. Yeah, thank you for the question.
Of course, and as you mentioned too, I'll make sure to include the NARM website as an additional resource for this session, so that we correct like you just have in your presentation, which is fantastic. And then speaking of elders too, there was a comment that I think is great to end on. That this person said, I just wanted to say that as a First Nations Addictions Treatment Center, where we are moving away from Western theories to more of our own traditional ways of healing, getting back to their own culture, I have to say it looks like NARM is doing the same. I'm definitely going to give this a serious look for our clients. It looks very interesting. So that's a great tie-in with the content that you were just mentioning.
Aichka, thank you. Absolutely. Yeah.
Perfect.
Well, yeah, it's super cool. I'm feeling really energized. I had a healthy dose of anxiety before this, but I feel much better now. Thank you, Jeremy. I love working with you. And I'm really feeling heartful and encouraged and excited by the level of interest. And if it continues, perhaps we can have a sequel.
It seems like a lot of interest. So again, thank you so much, and stay tuned, I guess, for the next presentation that Annie will be hosting. And Annie, again, just to reiterate what everyone's saying, thank you so much for being so informative and just being such a calming presence. It's always nice to listen to the soothing voice. So thank you so much.
You're welcome. I don't always feel like that, but I do my best.
It came across today, so that's all that matters.
Thank you. Bye, everybody.
Thank you. And to everyone else in attendance today, thank you so much for your time and for making time to come out and listen to Annie's presentation. As mentioned at the beginning of today's session, I will be sending out a follow-up email sometime mid to late next week that will include a copy of Annie's wonderful presentation slides, as well as a recording of today's session, along with some additional resources mentioned. Until then, thank you so much.